is heart attacks or cancer. Um, Other types of specialists don't make anywhere near as much money, and I don't think that there's as much money being spent on research and development or other types of problems. Like, for example, an eye doctor or an ear, nose, and throat doctor. I they don't make anywhere near as much money.
Whoa. Yeah, because people are not dying that often from, yeah, as you mentioned, most people die from cardiovascular problems or cancer. Um, I just saw today on Instagram. Apparently, in Russia, they have this new cancer treatment where they use a particle collider in order to treat your cancer. They are able to redirect the particles directly into the cancer cells very precisely, not touching anything else, and destroy the cancer like that. Have you seen that?
No, I have not. The cancer research and treatment is outside of my wheelhouse, so that's not something that I would have to refer that person out to a different specialist.
I see. All right. Yeah, I saw it on Instagram, guys. So I, who knows, who knows how much is that? It's in Russia. Who knows? Another thing that I saw very recently, that was, if I'm not mistaken, Dr. Kevin, on your page on Instagram, there's this new treatment where they shoot lasers at your knee.
Yeah, I use laser therapy for people with knee pain. What laser therapy can do is it reduces inflammation, it reduces pain, it accelerates healing. And it does this without drugs, without surgery, without cutting. It's completely, it has no side effects, and it's wonderful. And I use a laser for helping people with knee pain, hip issues, low back pain, neck pain, all kinds of joint problems, and all kinds of muscular problems. I'll use it for foot pain. And what laser does is the laser penetrates below the surface of the skin, and it hits the target tissue, and it accelerates the healing and reduces the inflammation and swelling, and it's wonderful. It's really, really cutting edge stuff.
How can a laser do that? I mean, at the end of the day, lasers just concentrated energy, right?
That's right. So there's different. If you ever look at a rainbow, there's different colors of the rainbow. There's blue, there's green, there's red, there's yellow. So different spectrums of light energy can penetrate below the surface of the skin at different depths. So, for example, blue light can penetrate about 2 millimeters below the surface of the skin, not very deep. Then green light can penetrate about 4 to 6 millimeters below the surface of the skin. Red light can penetrate about 6 to 8 millimeters below the surface of the skin. Infrared light can penetrate between 20 and 100 millimeters below the surface of the skin. So depending on which color, which type of a laser that you're using can affect how deep the penetration can go. I use infrared light, and I use a very, very powerful laser, and it can penetrate very deep below the surface of the skin to arrive at the target tissue. So, for example, if it's a hip problem or if it's a lumbar spine issue, you got to go pretty deep to be able to hit the joint. And so the infrared light spectrum can penetrate really, really below the surface of the skin to hit that target tissue to accelerate the healing.
I still don't get it. Why just so you're heating it up?
Well, what my laser does not cause any thermal increase in the temperature. It doesn't heat it up at all. Some lasers will do that, but the laser that I do does not cause any increase in temperature. But what it does is a process called photobiostimulation, What that means is that it's accelerating the healing of the at the mitochondrial level. The mitochondria are organelles inside your cells that produce energy. So it stimulates them, it wakes them up, it causes them to produce more energy to get you better faster.
All right, I need one of those. It's like how big it is, like a flashlight size. How does that work?
No, the one that I have is about 4 feet tall. It's
Oh.
about 100 watts, and it looks like a spaceship.
Okay, you cannot just go on Amazon and buy one then.
Well, you could buy a laser pointer, but you're not gonna. It's not gonna do you very much good at that level.
Man, that's amazing. Who do you know who discovered that? Is a new thing? I never heard it before.
There is the lasers that I have were designed in Italy, and it's a very common procedure. I don't do that for treating thyroid issues or autoimmunity. I order lab tests for those things. I will order like blood, urine, stool, and saliva tests to look at objectively all the different variables that could be contributing to their problem. So, for example, with thyroid problems, aside from autoimmunity, which we talked about before, there are 9 different what I call triggers that can cause disruption with your thyroid function. There's things like anemia, which is where you're having problems transporting oxygen on your red blood cells. There is blood glucose imbalances like insulin resistance or diabetes. There is cortisol, which is produced by your adrenal glands that regulates your fight or flight response. There's sex hormones, things like estrogen, progesterone, and testosterone. Boys and girls make both, and they have to be in the right amounts for the right gender and the right age. There's chronic inflammation and oxidative stress. There's GI problems with absorption, problems with leaky gut syndrome, your microbiome. Um, that's where most of your neurotransmitters are made. There's oxidative stress. There is stealth infections. There's chemical sensitivities from household cleaners. All of these things have to be have to be analyzed, and they have to be taken into consideration. The medical doctor does not look at any of these things. They look at your TSH, and that's it. And then they give you a drug, and they say, "Thank you very much. I'll see you in 6 months. Have a good day." And they kick you out.
Wonderful. um, Doctor Kevin, I have a question about the insurance and how much the insurance controls the functional medicine. Because we talking about how much the insurance controls the allopathic healthcare,
Right.
right? But not the functional medicine. Is there a difference there?
There is. I don't allow insurance companies to dictate what the patient needs. I